Okay, so I decided to break that up so that you could just listen to these based on the type of waveform and indications. So now we're going to talk about high volt pulse current, primarily used for tissue healing and edema reduction. So here are the electrode placement in and around the wound. The negative electrode will promote healing of inflamed or infected wounds, and a positive electrode will promote healing of wounds with no inflammation. So the negative active pad is when we're in that acute inflammatory phase or acute edema. And the positive electrode, you want to think about that when you're more in that proliferation phase of healing. It's a monophasic waveform, so you can see that it's only on one side, right? You don't have the biphasic like we had with the other ones. This is what we call a twin peak. The pulse duration is somewhere between 40 and 100 microseconds, and the frequency is between 60 and 125 pulses per second. It's, again, a continuous on-off cycle. You want a comfortable sensation without a motor response. The treatment time is always longer, and they use this a lot in like a skilled nursing facilities where they wanted wound healing. But you could use it in a facility. It's a 45 to 60 minute treatment time, and ideally it's 5 days a week, so it's just not overly practical in an outpatient setting for someone to come in daily for that. So it's good for chronic venous wounds that have failed to heal with standard care, for pressure ulcers, those neuropathic ulcers, arterial and venous ulcers, and burns. The contraindications for this would be somebody who has a wound with osteomyelitis, which is an infection, over topical agents containing heavy metal ions, you don't want to burn them, systemic infections, cardiac pacemakers, those superficial metal implants, any active bleeding or malignancies, disoriented patients, and pregnancy. Areas to be precautious are those aesthetic skin, wounds totally occluded by eschar, which is a black keloid type conditions where you just really couldn't feel underneath, and you would probably most likely result in a burn in order to get the intensity up to where you needed it. Extreme edema, again, that's those pitting edemas that are having a different type of pathology we want to be care of. That heavy scarring of thick adipose tissue, the laryngeal and pharyngeal muscles of carotid sinus, and the amplitude's just uncomfortable for the patient. They can't tolerate the sensation. So for edema control, we talked about this. That's that acute inflammation. You're going to use that negative electrode for your active pad over the edema, and the dispersive electrode will be put more proximally so that the current goes much more pumping like towards the heart. Again, it's a high volt current of 40 to 100 milliseconds, 100 to 122 pulses per second for the pulse frequency. It's continuous. Again, you want that comfortable tingle, and it's a 20 to 30 minute treatment time. This was used quite a lot when I first got out of both PTA and PT school before the interferential currents came around. It's very effective for swelling, but it's definitely a little bit more uncomfortable, and so most clinics have gotten away from using this as they purchased interferential current. So there's not too many facilities where you'll find that they have the high volt still available for people to use. But if it is there, it can be very effective in that acute phase of inflammation. So here you can see that acute edema formation. We're utilizing elevation. There's the positive pad that's more proximal to where the swelling is in the ankle there. So that's the active pad, and it's just pumping it up. Here's edema caused by lack of motion. So they're actually having them contract while that machine is on to kind of get some active range of motion, active pumping going while the machine is working. Okay? So edema control, you're going to have that lack of muscle contraction, the electrode placement on the muscle around the main veins draining area. It's a pulse biphasic or Russian protocol. Here's the pulse duration, could be 150 to 300 milliseconds, the frequency 35 to 50. You want 1 to 2 seconds on and 1 to 2 seconds off, so that's that 1-to-1 protocol we were talking about, and you want a small visible muscle contraction. That lasts for 20 to 30 minutes. Okay? And we have iontophoresis. So we'll stop there and we'll do that as a separate video.